Hi, this is Dr. Frank Chopatini with the Church of Rational Truth. Today we're going to talk about a study that was put out called the FAST-01 study, which was a type of radiation therapy for cancer treatments. It was something I read today. I thought it was pretty interesting, so I thought I'd talk a little bit about it. Basically, radiation therapy is a form of cancer treatment. Basically, you take ionizing radiation, similar radiation to X-rays, or other electromagnetic rays that actually induce cellular damage. These rays actually can interact with our cells and damage our DNA and end up destroying them. Why is that good? Well, normally it's not good, but we can actually target it specifically at cancer cells. So if certain types of cancer exist in the body, you can have someone go for radiation where they're put in a big machine. They put markers on to try and target exactly where the cancer is in that person's body, and then you give that radiation to that person in high enough doses to kill the cancer, but hopefully not to destroy too much surrounding tissue. The problem with current radiation therapy is it's only useful for certain cancers, and it has some bad side effects. It can damage the other tissue around it because you can't only get to the tissue, you hit the surrounding tissues, or you hit some of the tissues that the radio frequency waves have to go through. Not radio frequency, the electromagnetic waves have to go through. So the radiation has to go through regular tissue, and it damages that regular tissue on top of the cancer tissue. Now, they do certain things with typical radiation treatments to help minimize the toxicity to other areas, because obviously you don't want to damage good, healthy tissue. You just want to kill the cancer or the bad tissues. So they try to take it from multiple areas and then all kind of converge on just where the cancer is, but you still get toxicity in some of those other areas depending on how strong the radiation is, what's adjacent to it, what type of tumor, how long the treatment is. The other downside of current radiation treatments is they take a long time and you have to go back several times. So a treatment can be, 15, 30 minutes long, maybe even longer depending on all the prep time and getting into the machine. So what these people did in this FLASH trial, this is a first trial that they put out, and it was just on peripheral tumors, so it sounds like just tumors on the arms and legs or ones that are not really close to a whole lot of vital organs. And what they did is instead of having these longer, drawn-out radiation periods or treatments, they did a flash dose of radiation. They did a much, much stronger dose of radiation in a very, very short time. I think it was 0.3 seconds, which if you think about that, that is that fast. So what they're trying to do is they're trying to get all the benefits of radiation therapy, but actually take some of the side effects and reduce the damage to adjacent structures. How successful is that going to be? Well, we will see. This was just an initial trial. I think they only had like 10 or 12 participants, not a huge number, but I think this was the first one that was done in humans, and they seem to have very little side effects from it. Now, they are doing it with peripheral tumors, not ones that are close to a lot of other organs, and those ones are going to have a lot more side effects because you're hitting more vital organs. Now, they didn't have really much pain at the surrounding area, or it seemed like that was minimal and comparative to other radiation treatments, and it also seems like it was fairly well tolerated, at least as well tolerated, and it seems like they will have similar effects in terms of destroying the cancer than the traditional radiation therapy. This could be huge. This could be a big leap if it does have less toxicity. My opinion, I'm not sure yet. It's only one small trial. It's only some tumors. I would love to see it in more people. I'd love to see it with more scary tumors, brain tumors, GI tumors, chest tumors, ones that are next to really vital organs. Is it going to be good enough to just target it and not cause a lot of outside cellular damage having that one single flash? I think that's going to be dependent on whether this is something that is specifically more damaging to cancer cells, because maybe they don't have as good machinery to deal with very high dose radiation versus regular cells. I don't know. If it is, that could be really big. The one thing I worry about is if it doesn't, if all the cells react the same way, it might not have a significant difference in terms of side effects. But I would say the one big benefit is if it is at least as good, you're going to see an improvement in efficiency of treatment. If we can get it down to the entire treatment being under 15 minutes, getting in, out, and done, well, that's a very big advantage. You can go through many more people, you can churn it out, you can make it a less difficult experience. I have had a couple of patients go through radiation. it's not fun. It takes up time, it is stressful, the machine can be annoying, possibly even dangerous. So if we can take that down to much less time, it's going to be at least a big advantage in terms of savings and convenience. So let's hope that it does show more, but we're going to have to wait till the FAST-02 trial when they start doing it with more people. And like anything with science, for people out there who are not very scientifically minded, you never take one study. One study is just one single piece of information. You need multiple studies over time done by different people all finding the same results. Who knows if these 10 people just happen to have really good results out of chance? We don't know. So we have to keep studying, we have to redo it, we have to do it bigger, better, different, and then hopefully we keep seeing similar or better outcomes, and if so, wonderful. If not, well, then we'll have to see how much better or worse is this than our current level of treatment in terms of radiation. But I am optimistically excited. I take all of these with a grain of salt because, it seems like these are something you see every single day where a new treatment comes out that's promising to be the latest and greatest. But like anything, we will keep on it, we will watch it as it goes, and then hopefully, fingers crossed, if it does end up being at least more efficient than current radiation treatments, that hopefully it'll start being adopted and we'll start seeing it more and more commonly done. But this is still super early. I wouldn't be surprised if it took 5 or 10 years for this to even start being seen in practice if it did show improvement. But we'll have to wait for them to do the next studies on humans and see, fingers crossed, is this thing still looking like a very good or useful treatment for people with cancer. That's it for this topic. Stay tuned. We'll probably do another one next week. I think we're going to do another one that's health related. I think GLP-1 agonists or antagonists. And we will talk more about that next time. If you like seeing health-based discussions, talks, lectures, let us know. If you like seeing morality-based lectures, let us know. If you want to see different lectures, let us know. We have a subreddit. We have comments on YouTube. We have a Discord that doesn't really get used. Reach out to us, let us know, and we'll start making the content you all want to see. Once again, this is Dr. Frank with the Church of Rational Truth, signing off.